Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Catatonia. So here the catatonia, it is nothing but a clinical syndrome. It is a clinical syndrome and it is characterized by a distinct constellation. There is a distinct constellations and this is of a psychomotor. Distinct constellation of the psychomotor disturbances. And there are two subtypes, they have been described. So as per the two subtypes which have been described, they are retarded as well as and excited. So they can be retarded as well as excited. And looking at the retarded catatonia. So here in retarded catatonia, it is associated with the signs and reflecting a paucity of the movement. So there is paucity of the movement, including the immobility, the staring, the mutism, as well as the rigidity, withdrawal and refusal to eat. Next is along with the bizarre features such as the posturing, there can be grimacing, the negativism, waxy flexibility, the echolalia. Then comes the echopraxia, the stereotypy, the verbigeration, the autonomic obedience, automatic obedience. So all this can be seen. Then can be excited catatonia. Excited catatonia is characterized by several psychomotor agitations. So psychomotor agitations and potentially leading to the life threatening. So there can be life threatening complications such as the hypothermia. So there can be life threatening complications such as hypothermia, the altered mental status, then autonomic dysfunction as well. Dysfunction. So basically these are the motor symptoms. Next is the catatonic S. So here there is the acute onset in case of teens and in early adult, and this is the best prognosis. There is a catatonia leading to death. So this is known as acute lethal catatonia. Now looking at the symptoms. So symptom wise, there is in case if the patient has 3 or more symptoms among these, so 3 or more among these. So what does it include? It can be stupor, that is extremely hyperactive, or immobility. Then comes excitement. So under excitement, it is extreme hyperactivity and there is no goal directed activities, non-goal directed activities. Then comes the mutism. Mutism is where there is no or little verbal communication. No or little verbal communication. Then comes the catalepsy. This catalepsy means maintaining the odd posture for a long time. So odd posture for a long time. So example is the examiner asks the patients to be a particular position and the patient maintains it for a longer time. Then posturing is the same as the catalepsy, and this is an active phenomenon. There is a patient himself, they gets into the posture. So after getting into the posture and maintains it for a longer time. Next is the waxy flexibility. So another waxy flexibility is a feeling of resistance while making a passive movement and on the patient, like bending a wax candle. So then there is also the negativism. So negativism means that the patient opposes or gives no response to the instructions. Then comes automatic obedience. The automatic obedience means that the patient becomes excessively cooperative. Then looking at the mannerism, there is a repetitive odd movements. The repetitive odd movements are seen, they are nothing but the purposeful movements. So when you're looking at the mannerism, so we saw mannerism, repetitive odd movements, which can be purposeful movements. Then looking at the stereotype, it is repetitive odd movements, that is non-purposeful. So odd movements, that is in case of stereotype, repetitive odd movements, that is non-purposeful. Then moving on to echolalia. The echolalia means the mimicking the examiner's speech. So you mimic the examiner's speech. Then the echopraxia. So echopraxia means that there is a mimicking of the examiner's action. So examiner's action is what you mimic. Then comes the grimacing. Grimacing means maintaining of the odd facial expressions. Then looking at the ambitendency. Ambitendency means inability to decide the motor movements. To learn and grow daily like this, please do subscribe.